It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox. Welcome back to another edition of the Best Knox Network, which features some of the best procedures as well as doctors in the Dallas-Fort Worth area that help change people's lives. Like our first doctor, Dr. Patrick Allen.
Have been living kind of with daily headaches for 13 to 14 years probably. I have done all kinds of different hormone therapy throughout the years, just trying to help my headaches and energy level, sublingual drops, compound pharmacy type stuff, and seen different doctors, and had been driving back and forth to Austin for years. And a lot of it I knew was hormone related, and a lot of it allergy related.
Pellet therapy's been around over 30 years. This is bioidentical estrogen and testosterone, and you think, well, what is bioidentical? Bioidentical means it's exactly what your body makes. It's not derivative, it's not a synthetic, it's what your body already makes.
They draw blood work, and that takes about a week, and then you come back in and he inserts the pellet into your hip, and it's about, he says, the size of about rice. Depends on how much you need as to how many go in at one time.
The pellets in the females, they last for 3 to 4 months. The pellets in the males, they last for 5 to 6 months. They dissolve as you use them up. Now, how long they last depends on your cardiac output. So if you're super active, they may not last quite as long. If you're a little more sedentary, they may last a little bit longer.
Very simple procedure, just deaden that area in his office. It's an outpatient thing. I mean, it just feels like just maybe a little sting going in. That was about it. And you wear a bandage for, I think it was like 5 or 6 days, and you can't swim and get it, extremely wet like that. But other than that, it's just a little bit of soreness, and within 3 to 4 days, really being able to tell the difference.
By not taking a synthetic estrogen for women, it doesn't go through the liver, so you don't have quite the effect on lipids, and you have more reproducible, constant levels of estrogen.
I tried so many things before that it was kind of like, oh yeah, I'll try anything to feel better, just to feel more like myself again. The difference for me was just knowing this could last anywhere from 3 to 6 months, and I'm not having to remember to put a cream on every day or take a pill every day or something like that. It's done. You can forget about it and just feel great and go on and not remember to do something every day. I just feel like I'm not as tense all the time since I've started this.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
Cindy, a loving mother, had a weight problem until she met Dr. Clayton Frenzel. And look at her now. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com. Best Docs Network DFW is presented by Forest Park Medical Center. Extraordinary is all we do.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor. So I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
Patients with chronic hoarseness or chronic voice disorders typically present with complaints of inability to use their voice, a change in their singing voice, a loss of the ability to speak loudly, loss of their ability to maintain their pitch. And if it occurs over a longer period than 2 to 3 weeks, then it's something that patients should seek evaluation.
I actually just noticed a change in the tone of my voice, and I would say that was probably 4 years ago. It just seemed lower. So that's the first thing I noticed. Then as the months progressed, my voice I would describe it as break. Just, I couldn't talk in a smooth tone. I'm in sales, so I talk all the time. And it's also very straining on my vocal cord. As I talk, it just tires me out.
In the case of Donna French, she presented with a long history of vocal tremor, or her voice would spasm and she couldn't sing. Her normal speaking voice was affected by it and was causing her a lot of stress.
When Dr. James diagnosed me with spasmodic dysphonia, he explained it as a vocal cord are going into spasms. I don't ever lose my voice completely, but I notice the tone is lower and it's just cracked, and as it goes on, the actual sounds get shorter and shorter between words.
We scheduled her for Botox injections into the vocal cords.
The procedure itself is so simple. I was surprised. After the injection, it takes approximately 24 to 48 hours for the Botox to actually bring my voice to what we call the breathy phase.
She experienced about 2 weeks of hoarseness where her voice was very breathy, but then her voice came back to normal without the spasms, and she had a normal voice for 4 months. Patients with spasmodic dysphonia typically require re-injections every 3 to 4 months.
Dr. James was the first person that really actually listened to what I was saying about my voice. So don't give up. Call Dr. James. He's a listener, he's compassionate, it's a painless procedure, and there's hope.
I just had gotten to where I was feeling run down all the time. I was feeling like my quality of life was slowly starting to deteriorate. I was starting to have some other medical problems, and it was just one thing after another, and I just felt like, you know, I had too many more years to live, and I didn't want to live having to deal with those kind of problems.
Ms. Cohn was about 40. She had a BMI of 41. She had been overweight most of her life. She didn't have a lot of medical problems, but she did have migraine headaches, and we talked about the options of what we could do, and she decided that she would like to have the sleeve.
I liked the fact that in removing the portion of the stomach that it does during the sleeve procedure, it also removes some of the hormones that triggers your hunger and your appetite, and I thought that that might have some impact on the migraines that I was having. With the hormonal changes and all of that might be related. So that's really why I decided to go with the sleeve.
She now has a pretty normal BMI, and she's keeping her weight off. She lost her weight over a year to 2 years, and she's doing really well. Interestingly enough, she no longer has migraine headaches.
As part of my lifestyle change, you know, obviously you make eating habit changes, but I also joined the gym to really change my physical activity level. January, before I had my surgery, I had done a 1 mile fun run walk. The sad part looking back at it is that I couldn't even finish the 1 mile. Then a year later, I kind of vowed that I was going to do the 5K in that same race, just kind of to prove to myself where I had been and where I had gotten to and what I had achieved. I ran the 5K and I actually placed 3rd in my age group, which was a total shock to me. That really was a wonderful feeling. I had taken advantage of the second chance that I got to change my life.
For more information on any of the doctors you've seen on today's program, head to the website, bestdocsnetwork.com. And now it's time to head to our next doctor who specializes in the hands. It's Dr. Stephen Troum.
nervous when you wake up, just make sure that everything worked and everything worked great. No numbness, no tingling. Normal, terrific.
With surgery, we were able to do an outpatient surgery, fix her wrist, put some plates and screws in it, get it nice and stable, and then she only has to be immobilized for 3 to 4 weeks and can start moving the wrist almost immediately after that.
Basically totally functioning. I can do anything that I was doing before. I laughed at I was just hoping I wouldn't have to be able to do push-ups or anything like that anymore, but I did get enough motion back to be able to do anything that I was doing before.
I'm very pleased with Susan's results. She did very well and she was a very good patient. What's good is she has medical background, so she was knowledgeable of the things that we needed to accomplish and what her role is in ensuring her success.
A person who is a candidate for the lipoabdominoplasty, the awake abdominoplasty procedure, is a person who has lost a pretty significant amount of weight, but they have excessive bulging of the skin here, excessive fat, loosening of the muscles, and they have too much fat on the sides. Any of those types of candidates will benefit from the lipoabdominoplasty, or what we call the awake tummy tuck.
I've always had a self-conscious body image of myself that I've been built like a boy, with never a waistline. And so as the years went on, I felt that that was getting more and more prevalent, and I was more self-conscious about it.
One of the nice things about the awake tummy tuck procedure is that when we pull this and stretch the skin down, it does so in a different fashion, such that the patient doesn't always just lean over like she always does with the traditional tummy tuck. Within a day or two, she can stand up pretty straight. She's sore, there's no question, but the pain is not nearly as bad as the traditional tummy tuck.
They would ask me if I could feel this or that, and I never felt a thing. I didn't even know that they were doing anything. So it went very, very well.
What most people like to have when they do the abdominoplasty is a very low-cut scar. With the lipoabdominoplasty, we try to do the incision in a very low fashion so that the patient could still wear a bikini, and yet she has a scar there, but the bikini pretty much covers up the scar.
I wear a bikini very comfortably. I was very, very pleased with the outcome. My energy level seemed to boost. My self-esteem about the body image, and just wanting to get out and kind of show it off.
We were able to do extensive liposuction here and give her a nice waist, reduce some of the muffin tops that she had, and give her a nice flat contour to her abdomen. Pull the muscles in a little bit, stretch the skin. She looks great.
I can't say enough about Dr. Troum. He listens, he is very concerned, he offers excellent advice, and he's not pushy about any of the procedures that he offers. His bedside manner is the best.
Neck pain due to facet arthritis is a common disease. Typically, patients have dull, aching pain in their neck. It's usually on both sides of the neck. The pain can go up towards the back part of their head or can go down their shoulders. It's usually worse with movements or activities, and it's better with rest.
I was having lots of pain, experiencing lots of pain in my right shoulder, my neck, and my shoulder blade. I played the keyboard for my church, and it was causing me problems to be able to last doing that, and to do housework and to function.
Miss Allen asked me to help her with her neck pain. She had it for a long time. She tried stretching exercises, she tried physical therapy, she tried different medications to help with her pain. Nothing made a gigantic difference. She had an MRI for cervical spine of her neck, and it showed that she had significant arthritis and degeneration at several levels in her neck.
When I came in, we tried some medication first, and the pain did not get any better. It got worse instead.
When I saw her in the office, she had typical presentation of neck pain due to facet disease. At the time, we figured out which joints in her neck are the painful ones, and we did an outpatient procedure called facet joint steroid injections on her, where we injected some steroids and local anesthetic into the affected joints in her neck, and she did well.
Instead of doing any kind of surgery, I wanted to go this route first, and so did Dr. Farhat. So we did this first. It's been working, and there's no stiffness, no anything, so I've got the pain freedom.
It's been years since she complained to me about her neck. At the time, she quoted her improvement at more than 80–90%, and she's been fine since.
I'm very grateful because he has made it possible for me to have the strength that I have and to be able to go and do the things that I can do now that I couldn't do before. And it's made my life an extension of the things that I couldn't do, and I am very thankful. He has made it possible for me to have the pain freedom that I have.
Cindy had trouble losing weight until she met Dr. Kim. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com.
We hear when you're a kid in school and all talking about having good hygiene and keeping your body clean and this sort of thing. It is very important. Most people don't realize that there are a lot of very dangerous microorganisms out there. There are things like staph, there are viruses, or all sorts of things. We hear stuff in the news about the avian flu and all these sort of things. And if you don't use good hygiene, you don't keep your hands clean, if you take your hands, touch your nose, your eyes, your mouth, those are ways that you can transmit diseases to your body. And there are some organisms out there that just by being in certain situations you can be exposed to, like this very dangerous methicillin-resistant Staph aureus, the MRSA that a lot of people have heard of. That can really be a very dangerous bacterium. And we're finding more and more of these cases are acquired in the community. Years ago they were only in the hospital, but now we see a lot of people just getting them just in general. So there are a lot of things like that that can cause problems that people don't understand where you can actually acquire one of these infections. For that reason, it's very important that people do keep their skin clean, that they do wash their hands relatively frequently or use one of the hand cleansers, and especially if they are a carrier of something like staph, to use some kind of measure to keep their body from developing a boil or one of these more dangerous infections. And so as a consequence, after you've been in that environment, you really ought to use some kind of a measure to sort of sterilize your skin, so to speak, and make sure that you take either a shower or wash your hands or something at the very least to make sure that you're not going to actually be colonized with one of these organisms that can lead to a more serious problem. One of the ways that we're kind of excited about is that we've developed this new bleach-containing wash. Bleach is very strong antiseptic product. It actually kills just about any bacterium, kills a lot of other things like viruses and even fungi. And if you use something like this, it will cleanse your body quite well, and if you use it on a periodic basis, you can maintain your body from actually getting colonized and keep it sterile or keep it cleaner for a longer period of time. So we recommend using something like that or one of the antibacterial soaps or something to keep your skin from getting one of these serious infections.
Chronic ulcerative colitis is one of the forms of what we call inflammatory bowel disease. There are two main types, chronic ulcerative colitis and Crohn's disease. The differences are Crohn's disease can involve any part of the GI tract, from the mouth all the way down to the anal area, whereas chronic ulcerative colitis is confined only to the colon.
Well, I had ulcerative colitis and had fighted it for many years. Probably 10 plus years, and just it got to the point to where it was just, I couldn't function normally. I was constantly sick and just didn't have a normal life. As I was young, I was active. I liked to be with friends and go do things outdoors and camping, and I loved to do things like that, but couldn't do them because I was sick all the time.
The medicines that she was requiring at the time increased. And as you increase those medications or to different class of medications, the side effects were becoming prohibitive. And so she needed to have surgery.
He gave me several alternatives of different surgeries that could be done. And of course, with my lifestyle and as young as I was, the J-pouch was the best alternative for me at the time.
She did undergo the procedure, which is, the official name is proctocolectomy with ilioanal J-pouch.
The great thing about this is it's internal. I still continue to be able to function normally. Well, it's been 18 years since I had my surgery. life is so much better. I don't have pain, I can get out of bed in the morning, I can do all the things that I want to do. I can go camping now.
In addition to the routine screening that might be recommended for colon cancer at a certain age, patients with chronic ulcerative colitis should be regularly monitored on a regular basis with biopsies to watch for any signs of what we call dysplasia, which are severe precancerous changes.
The reason I would recommend Dr. Cloud is because he's very much a people person. He's very good at what he does, and he'll stay in touch and make sure that you get the result that you want.
Before coming to see Dr. Wallace, I'd had implants, and my implants were put in or finished by May 1989. And all of a sudden, in February of 2011, the top went south. I knew the implant was loose and it hurt, and my dentist, of course, recommended Dr. Wallace.
Shirley came to us with a little concern. She had had a lot of dentistry done in the past, and she had actually had implants years ago. They had replaced several teeth. She had very big bridges, and they were getting loose, and she knew that there was a problem. She was having some pain.
The way they're doing it now, all Dr. Wallace did was pull the teeth, put the implants in, and you get teeth same day.
We saw Shirley, and immediately we knew we needed to move forward with an EverSmile procedure for her. This gave us the ability to remove all the remaining teeth that were bad. Once we had that done, we were able to place implants and give her a whole new smile the same day. She was ecstatic.
My friends don't even know. They knew that I went through it. They're just amazed how pretty my teeth are.
So when Shirley came in, we got a 3D CT scan. We evaluated the remaining bone and the teeth and decided the EverSmile was the perfect procedure for her. She came in for surgery. We removed all the bad teeth. We put in all new implants, gave her a whole new set of teeth. And I tell you what, within minutes of waking up, she's in the mirror, she's ready to go. She is, again, going a million miles an hour. And the EverSmile that we gave her is probably the only thing that's going to be able to keep up with her.
But I mean, I was up and at 'em. I had it done on Thursday, and I was back playing bridge on Monday.
So now we combine the success rate of implants, which is single-handedly the most successful form of dentistry we have. We use that type of technology, the latest and most advanced imaging and planning techniques, and give her a new EverSmile. It's highly successful. It goes in the same day. It's exactly the teeth she wanted. You can't do that with anything else in dentistry. It's amazing.
Best Docs Network, DFW, is brought to you by Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. All right, that'll do it. That'll wrap up another edition of the Best Docs Network, which features some of the best doctors in the Dallas-Fort Worth area that, of course, help change people's lives. You want to see more, you can do so. Head to the website, bestdocsnetwork.com. And if you have a question or comment for us, send us an email. Love to hear from you. It is info@bestdocsnetwork.com. So long, everyone. We'll see you next week.